Hi, my name's Claire Conroy. I'm a physical therapist. I work at an outpatient neurological rehabilitation center in Houston, Texas. I have the blessing of working with a lot of patients in different stages of cancer, and specifically patients who have breast cancer. At our clinic, we have recently started a breast cancer prehabilitation program. So, what that is patients who have just been diagnosed at different stages of their cancer and in their treatment will come to the physical therapist and occupational therapists at our facility, and they will get some baseline measurements, and then we will also give them education and some information about the exercises that they should be doing, what type of pain is good pain, acceptable pain, and what is kind of a red flag that they should go back and see their doctor about. With the prehabilitation patients, we'd like to take a lot of baseline measurements. A lot of times this is before the patients have started to go through chemotherapy, radiation therapy, or have had any surgery. And then we let them know what to expect with those different types of treatments. That way they know if they start to experience a lot of fatigue, we give them some exercises that they can do at home. But if they feel as if it's really inhibiting their functional abilities, they can come back and see us, and that way we have some baseline measurements of where they were before they started their treatment, so we kind of have a good idea of where we want to get back to with them. Additionally, a lot of patients who undergo radiation and chemotherapy treatment will experience peripheral neuropathies. So from the physical therapy standpoint, we work with a lot of balance activities, because when you have peripheral neuropathies in the feet, that can make balance difficult. You can trip over things. So we make sure and we educate the patients about that, and then do a lot of balance training with them. And then throughout the treatment, afterwards, there are lots of side effects that we can treat. A lot of times patients will have ligamentous laxities, so we can work on strengthening and stabilization exercises. It really just depends on functionally how the patient is affected by their treatments. In our clinic, our occupational therapists are the lymph certified therapists. So a lot of times they'll see our breast cancer patients if they've had lymph node resections, because then a lot of times that they'll have lymph issues, especially in their upper extremities, predominantly on the side that they're affected. And then we also have a social worker that can help these patients a lot of times that are dealing with a new diagnosis to really kind of navigate who all they need to be seeing and give them any support that they may need on top of that. Hope this was helpful.
Currently in our facility, we treat all kinds of patients, cancer diagnoses. So every type of cancer diagnosis is there, but our biggest patient population is that of patients with breast cancer. Breast cancer is actually very complicated. There are many different kinds, and so the treatment regimens can be very different. But this, especially with this patient population, there are a lot of physical changes that happen that actually make the patients feel much different about themselves. So the role of the oncology nurse is not obviously to help them get through the treatment and manage the side effects and provide the treatment for them, but to also deal with some of those psychosocial changes that happen because of the personal image that the patient has, losing their hair, many times having surgery or a mastectomy or a lumpectomy. So their body figure also changes. So it's really helping that patient get through all of that and understanding and living with the new them. So we also provide breast cancer support to our patients, as well as survivorship plans. And this is care when they are actually done with their treatment. Many patients aren't sure what happens next, and so we provide them with basically a portfolio and guidance as to what happens from here on out, so that they're not caught unaware, and we help them get back into their life, what it was prior to, as best as they can, or sort of into their new normal. So many things that we can do with patients with breast cancer diagnoses. In the oncology arena, there are many healthcare professionals. So we work daily with all types of different disciplines. Social work is a huge component of what we do with patients with cancer, because patients many times have not only emotional changes, but they have financial changes. So there's many needs that are actually cared for by the social worker. We have medical assistants who do the daily care of putting patients in rooms and taking vital signs and bringing them drinks and things like that. They are good listeners as well. If the nurse is not actually drawing the blood, because many times patients have a central line or a device that we actually draw out ourselves. We have phlebotomists who work with us. There are physicians, obviously, who guide the care of what we're doing, and we deal with radiology. We deal with any aspect of healthcare, because patients with cancer diagnoses actually go through many things. They have to have workups. They have to have continued follow-up in monitoring what's happening with their illness. Surgery many times is an option of care. Radiation is an option of care, so we're dealing with radiation oncologists. In radiation, you deal with physicists, you deal with many nurse practitioners, as well as nurses, and physical therapy and occupational therapy. So many changes that happen with our patients that sometimes there's guidance that's needed to help them get back on their feet and determine what's happening with them. So it's an area that you get to deal with pretty much every discipline in the healthcare arena. That makes it somewhat well-rounded on a daily basis, that we get to deal with others within the healthcare. Best job ever. That's all I can say. Hi, my name is Carrie Shajai. I am a registered nurse and an oncology certified nurse. I currently am the nurse manager for a cancer center in Houston, Texas, by the name of Kelsey-Seybold Cancer Center. I have been an oncology nurse for greater than 20 years and have been very fortunate in my career that I've provided care in many different ways with cancer patients. First and foremost, I was an inpatient nurse and as well as an outpatient nurse, where I actually gave chemotherapy as well as mixed the drugs themselves before they were given. I have been a clinical educator for a hospital system as the oncology nurse educator, and I was also a clinical trials nurse for several years. In addition to that, I was a hospice and palliative care manager, so I got to deal with patients who were having changes in their treatment regimens, as well as changes in what was happening with their disease, and then obviously at end of life with the hospice entity. And my most recent position prior to becoming a nurse manager was a stem cell transplant coordinator, which was a very interesting position as well. So very well-rounded, very fortunate to work in oncology care. There's nothing better than being an oncology nurse. You get many times people ask you, how can you deal with that? And it's because in this role, the rewards are more for you than what you're doing. The things that you get back from the patients. Our patients come into our center with who they are, and now become a different person, because now that cancer diagnosis is with them forever and ever. So their lives are forever changed. So the role of an oncology nurse is to help them get through their journey with cancer, and to make it as seamless as possible, as gentle as possible. It requires a lot of education, compassion, good listening ears, as well as